Thank you, Madam Chair. I appreciate the opportunity this afternoon to speak on my amendment to the underlying bill, which, as we know, does help to unlock the growth and prosperity of our nation's small businesses and their employees. My amendment is simple and straightforward. It will ensure that small businesses and employers, particularly those in rural communities across the country, are made aware of tax-advantaged, flexible health insurance benefits. Employers, especially in the rural areas like the ones I represent in upstate New York, should have the tools to provide their employees with various options to lower their health care costs and access quality care. As a member of the House Small Business Committee, I know the unique challenges businesses in rural communities and those business owners and employees face every day. And with a comprehensive focus on rural areas, we can help ensure that all businesses, regardless of their zip code, have equal opportunity to provide affordable, high-quality health care benefits. And with that, Madam Chair, I thank you for the opportunity to speak to this amendment. I urge consideration of it, and I yield back my time.
Does the gentleman reserve or yield?
The gentleman reserves.
The gentleman from New York reserves. And for what purpose does the gentleman from Texas
I would claim
seek
time in
recognition?
opposition to the amendment.
The gentleman is recognized for 5 minutes.
And I would yield myself such time as I may consume.
The gentleman is recognized.
This amendment has a rather nominal effect in not improving what is a very bad and deceptive bill. It's appealing to talk about rural areas. I'm concerned about those rural areas, about the chicken pluckers, about the meat packers, about the field workers, and the way they will be discriminated against under this bill. I would just elaborate on that while this is mainly a Republican caucus that follows the seditious Pied Piper who was our president, that in this case, even under the Trump administration, when they considered this kind of proposal, the Treasury Department, the Labor Department, the Health and Human Services Department came together and recognized the danger of discriminating against different classes of employees. But ultimately, unfortunately, the Trump administration did not provide the protection against discrimination, so that people that are working in rural areas under this bill may be discriminated against by their employer as a result of this legislation. It is the failure to have clear language in this bill to prevent such discrimination against rural workers in favor of those who are in the office towers managing everything that is at the heart of our opposition, as well as the refusal to provide protection and guarantees against people being denied as a result of their pre-existing conditions. Rural Americans are more likely to die from heart disease, cancer, stroke, unintentional injury, and respiratory disease. Yet we would take our sickest workers, our most vulnerable low-income workers, and deny them a comprehensive employer plan with many protections, allow them to be the subject of discrimination. And there's already been too much discrimination against rural areas and rural workers. We ought to prevent it, not make it worse. No guarantees that these people can find any coverage with their ICHRA plan, let alone affordable and quality coverage. I think that rural Americans deserve far better than this amendment to try to put a patch on a very sorry bill that undermines the protections of the Affordable Care Act that has offered great benefit to so many Americans, and I would urge everyone to vote no and reserve the balance of my time.
The gentleman from Texas reserves, and the gentleman from New York is recognized.
Thank you, Madam Chair. I yield 30 seconds to the gentlelady from North Carolina.
Gentlelady from North Carolina is recognized.
Thank you, Madam Chairman. I appreciate Mr. Molinaro's amendment. I support it, and I appreciate his working to make a good bill better. I yield back.
Gentlelady yields back. The gentleman from New York.
Madam Chair, just to reinforce on the amendment, this is meant to provide education and outreach.
Is the gentleman
yield myself such time as necessary to explain my
recognized.
Thank you, Madam Chair. This amendment, as a reminder to my colleagues across the aisle, is simply meant to broaden access and educate small business owners all across this country as to the benefits that are available to them to access affordable, quality health care. And with that, I yield back.
The gentleman from New York yields back, and the gentleman from Texas is recognized.
I yield myself such time as I may consume. And
Gentleman is
Madam
recognized.
Speaker, I would just say that the only education that would be really helpful on this bill would be to educate both employers and employees about all the shortcomings of this bill. Educating employers that they ought not to be discriminating against classes of workers and treating the rural, hardworking employees there at lower wages differently, where they get an ICRA policy that denies them pre-existing conditions, that denies them the essential benefits under the Affordable Care Act, while the folks in the city in management, they get treated differently, and they get a concierge kind of treatment that is not available to the rural workers. And so just educating about this bill, which allows that discrimination, would not accomplish much of anything. I think what we're going to see with this kind of legislation is more and more workers in rural areas as well as urban areas who face discrimination and who face great medical debt, because these plans are so weak, they are junk insurance that will deny the benefits that most people need. Educating about them, if truthful education, if not the kind of deception that is buried in this bill, educating about them will only tell people the limitations and the shortcomings. Otherwise, it will be a kind of education that covers up, as this bill does, the great harm that is being done in denying folks access to a family physician with the protection that is there. Remember that in moving to these ICRA plans, we already know that 95% of those that are in ICRA plans today that have this icky kind of coverage, they are people that once had good group health insurance that I'd like to see available to more Americans. So with that, again, I would urge my colleagues to definitely vote no on this amendment and vote no on this sorry bill and support our motion to recommit. I yield back.
Gentleman from Texas yields back.